I think there's multiple fronts. So obviously I've been pushing the app side of things, but those are limited in the sense that they're not holistic, or they're not holistic at the moment. There's no doubt that the gold standard is to have, if you're aphasic, you want a speech and language therapist. So I think of them as expert coaches. Again, going back to this sporting metaphor, what you want is somebody who understands the language system, understands how it's gone wrong, can assess you and can work out some strategies to get your language behaviour in better, and get those improvements in impairment to carry over into what we call function. In other words, real world language use. So, when you go to the coffee shop, you can order a coffee, or you go to the pub, you can order a drink, or all those sorts of things. So you can socialize more, because basically that's what language is for. Language is largely about socializing with other people. And people with aphasia do get very isolated. So the gold standard is to have a speech and language therapist, but they're quite rightly expensive. And our healthcare service in the UK, but as I've said, it's true in other healthcare services, there just isn't enough access to what you need. After a brain injury, you maybe need 100 hours of therapy to make a significant improvement in your functional communication. So that's not bringing you back anywhere to normal, but it's just giving you a boost that you would notice that makes a difference to your life. And most patients will get around 10 hours in total, so nowhere near enough. So another thing that we've been doing to try and up the dose is something called an ICAP, which is an Intensive Comprehensive Aphasia Program. And this is kind of like a boot camp. We took the idea from the Queen Square Upper Limb Therapy Service that is commissioned on the NHS at the moment. So in that service, a patient with a weak upper limb will come in for sort of 3 weeks of really intensive therapy. They don't stay overnight in the hospital. They're what we call day attenders. So they sort of come at 9 o'clock and then leave again at 5, and they get worked over, again, with a whole bunch of things that therapists do. And we just copied that with the language model. So patients would come into our ICAP service and would get, we would aim for 6 or 7 hours of therapy a day, 4 days a week, which is pretty tough. And a mixture of one-to-ones with the therapists, dyads, so working in pairs, and working in groups. We would bring patients in groups of 4. And we would also work with their partners or carers as well, because any gains that they make in the 3 or 4 weeks that they're with us, which most people do make quite big gains, those will be lost if they're not built upon, once people are back in the community, back at home. So that, and again, these ICAPs are not something we came up with. They've been around for many years, but again, they're relatively expensive. So the cost of our ICAP, 90% of the cost is staff costs, and when we've run our one, it costs about £300,000 a year. And we got some charity funding from the National Brain Appeal to run that for a couple of years. We've just finished our 2nd year. Unfortunately, because of COVID, we haven't been able to get commissioned with the NHS, but that's our aim. So that works out at about £5,000 a patient, which is a lot more than would be spent on them, in standard NHS care. And often get asked, how are you going to save the NHS money? Well, we're not going to save the NHS money because the NHS is not, spending enough money on these patients. But £5,000 is about the same as a hip replacement, a bit less actually. And nobody sort of is up in arms about how much hip replacements cost. And of course, hip replacement makes a big difference to people's lives, gets them mobile, gets them out and about, gets them economically back in society. But the same is true of aphasia therapy. And there's been quite a lot of work, and it's as you can imagine, it's pretty, it's bad having a fractured hip, but it's actually even worse having a language problem.